The federal government announced plans to reschedule medical marijuana to make it easier for research to be done, as well as potentially for patient access. But there is concern as to what impact this could have at the state level with the state programs, as well as what involvement this may give Big Pharma. So let's talk about it. Hey everybody, it's Dr. David, a board-certified pediatrician in Tampa, Florida. I believe the first pediatrician in the state who has been certifying patients, including pediatric patients, for medical cannabis. And from what I've been told, I've certified more people in the state than anybody in top 5 in the country, although I'm not sure how they do those calculations. But I have a lot of experience using medical marijuana, and this is a good day in my world because this is going to allow much more research and things to be done to really move things forward to optimizing the use of cannabinoids and this plant in the many different ways, many we don't even know about. Now, today I'm going to be talking about the federal scheduling, what that is all about. I'm going to talk about what the federal government just did regarding marijuana. And I'm also going to talk about how this will impact medical marijuana patients, as well as potential on the dispensaries themselves. I'm not going to be talking about anything regarding recreational marijuana today. Okay, so first, let's talk about the federal scheduling. So for 50 years, actually more than 50 years, cannabis has been classified as a Schedule 1 drug, which means there is no current medical use with high potential for abuse and or addiction. And I've made videos about that's how that is an absolutely ludicrous statement considering all the research that's been done. Schedule 1 medications would be things like LSD, heroin, ecstasy, quaaludes, peyote. Okay. Schedule 2, which is one step under, are drugs that may have some medically acceptable uses, but have a high potential for abuse and or addiction. And those are things like fentanyl, morphine, oxycodone, cocaine, Ritalin, Adderall. Okay. And then there's Schedule 3. This is what they're going to move it to. And Schedule 3 says moderate to low potential for physical or psychological dependence. And these are things like Tylenol with codeine, ketamine, anabolic steroids, testosterone. So obviously much further lower down than those, even what those Schedule 2s are. So what the DEA, the Drug Enforcement Agency, is approving is an opinion that was actually first put forth. This is kind of like the way things progress in the government. The Department of Health and Human Services, their statement, they put out an opinion that now again DEA is approving or has approved that the marijuana should be reclassified from the strictest Schedule 1 down to the Schedule 3. Some people question whether it should go scheduled even lower than that or rescheduled. We'll get to that in a little bit. But this is also the first time that the U.S. government has formally acknowledged its potential medical benefits. And I want to pause right there, okay? Because for so long, what's been said about the dirty weed, what's been said about just things that, but to say that there was no medical potential, obviously, it just was so ridiculous. But it is really nice to know that the U.S. government has formally said there are real medical benefits going on here. And so I just wanted to pause on that because this is kind of a big day for that to be happening. Okay, so what actually did happen here? So this is getting a little bit into the bureaucratic mess, but just so you have an understanding of where things are and where we're at, because it hasn't actually formally started yet. Okay, so the officials first they did is they cited evidence as to why they believe that cannabis does not possess a significant risk to public health, which is another big statement there. The federal government is saying that this does not pose a big risk to the public health. That's good. Obviously personal health, that's different, but to the public health. And what they also did is they frankly said, well, let's compare it to those other medications that are listed on the Controlled Substance Act that are ones that I mentioned, and so just the fact that they were willing to say, hey, if we're going to really talk about this, we got to talk relative to the other stuff and how they're scheduled. That was kind of a huge thing because even the things in the Schedule 3 that are the other ones that are listed there, I can make a strong argument that it doesn't even belong in a 3, but at least it's down. Now, with that, Attorney General Merrick Garland, he has submitted the rescheduling proposal to the White House Office of Management and Budget. He did that on Tuesday. That would have been the 30th of April. Okay. So I do want to thank the Biden administration for making this move. Many administrations in the past have had the opportunity to do this and they didn't, but this happened. Okay. They formally this is actually happening. Okay. Now, what is going to happen next? Okay. So first of all, so this proposal that was put in by Attorney General Garland, it's published in what's called the Federal Register. And there, it's with that, there starts a 60-day clock, a 60-day public comment period. And with that, that allows any interested party for or against to request hearings to be put onto the record. Okay. What they do with that, I guess they'll be listened to. But considering the lack of major opposition up until this point, it seems to be kind of more than a formality, but it's an important formality. It is the formality that our government rests on in terms of the processes. Now, after that, the Drug Enforcement Agency, the DEA, will write a final rule, okay? And that will be published in the Federal Register 30 days after the 60 days are over. And then after 30 days, that's when it formally becomes official. So we could be talking 90 days plus or minus, or 90 days plus, I guess. Now, more importantly, now that we've gotten over all the bureaucracy, how is this going to be helping medical cannabis patients? Okay. And again, I'm not talking about the legalization process. This is not making marijuana legal. Okay. To be clear. But what this is doing, it's really legitimizing cannabis for medical use, legitimizing the medical cannabis programs in the various states. Okay. And of course, with that, it should make it more acceptable to people who may have been on the fence as to whether they want to try it as a medicine. Because let's face it, obviously the states where they're at are saying, yes, it's okay. But if the federal government is saying it, people then know, if it's being used for medical, then I'm also being, having a level of protection. But also, hey, more people are acknowledging that it's okay. Now, in addition to that, it may very well push some of the states that do not currently have legal medical marijuana programs to do so, because the federal government, is now saying it's okay, and that's obviously a big thing. So again, that'll be kind of a nice thing to see if medical marijuana, hopefully, let's face it, it should be federally legal. But it'd be nice at least if it was legal in all 50 states, which would, I guess, be the same effect. But it's not right now. Hopefully this will move things in the right direction so people, not just like here in Florida and elsewhere, but everywhere, can get access to this wonderful medical plant. Now, also, another really big thing, it's going to help research get done. As of right now, it's almost impossible in America to do research on medical cannabis. There's only one strain. It's out of Mississippi. From what I understand, it's a pretty bad strain. That's allowed to be researched. But this will way open up what's allowed to be researched, not just the plant itself, but the individual constituents. Now, I realize when we talk about whole plant medicine, full spectrum products, etc., but also, there's so many minor cannabinoids. We've talked about CBD, and I've also talked about things like CBN, which helps for nighttime sleeping, and for CBG, which helps for anxiety. But this is going to allow all of this stuff to be researched, as well as THC and different formulations, and the potential for making synthetic versions of it. And I realize that's going to be something that Big Pharma would get involved in. But let's face it, if they're able to figure out something because it's done in a way with isolation, using cannabinoid structures to figure out a way to cure cancer, hey, or autoimmune diseases. And I'm not saying that will happen, but there's evidence that things are going that direction. So that would be obviously a beautiful benefit for this if it helps humanity in that way. Okay. Now, in addition to that, from a patient perspective, it will allow patients who goes into dispensaries right now, because of the issues with banking. The dispensaries are not allowed to take credit cards. They're not allowed to have a credit card account because of the way banks are looking at this, which we'll get into more. But so there are people who, if to go get their medicine, they're walking around with a couple $100s or more in the neighborhood. And obviously, a lot of people don't carry cash whatsoever. Right? Everything's electronic. Everything's on card. Some people don't really feel safe carrying around a lot of cash. This would allow credit cards to be used, which would alleviate the need to carry around large amounts of cash. Okay, now, in terms of impact on the medical marijuana industry as itself. So, first of all, a lot more is going to need to be figured out, because, again, state versus federal, there's a lot that can have to be figured out. Okay, so but in terms of some of the benefits, not just in terms of them being able to accept credit cards, other banking services, where to put their money. There's only a few banks that these companies are right now allowed to put their money because of what those companies are allowing. They're also able to get more capital. They're able to investments from a lot of different types of institutions. Financial institutions right now are not willing to work with these companies very well. It's very tough. This would open this up tremendously. Okay, relative especially to the federal scheduling one. Now, and also, realistically, this will probably lead to more patients for the dispensaries, because more people will probably sign up because they feel more comfortable doing it. Also, from what I understand, because they are mostly dealing currently with a Schedule 1 drug, the taxation on the companies is much higher than if it's lowered down to Schedule 3. I'm not a tax attorney or tax accountant, so I'm not going to go into the details. Because quite frankly, I don't know, nor do I care about that. But it should be help. If it's less taxes, maybe it'll reduce the prices to the patients. So that's a good thing too. Okay. Now, how this may hurt. Being that it's a Schedule 3 drug, right now, only Schedule 3 drugs, according to the federal government, can be purchased with at a pharmacy with a physician's prescription. And actually, because they're controlled substances, we have to go through a verification process. You have to have a DEA number. So there's a lot that goes on that has to happen in order for that to happen. So there's going to be a discrepancy, and that hasn't been figured out at all. That's going to probably be part of the rules. There's probably going to get caught up in litigation, so maybe it won't actually happen in 90 days. But that's something that we just don't know about. Okay. But another thing, if we don't know, if the way it's written that the states aren't going to be in compliance, how are some attorney generals going to react to that? Are they going to then say, "Oh, the federal government says that we're going to close down we're going to have to close down the dispensaries because they're not pharmacies"? We don't know. Hopefully that won't happen, but let's face it, every state does things a little differently, and we've seen different attorney generals have very different opinions on lots of different issues. Okay, another thing, this is not going to decriminalize marijuana on a federal level. Okay, so those laws will still be there, especially those who would be carrying it without a card. Okay, but also in terms of Big Pharma, okay, a lot of people are concerned that if Big Pharma takes over, what might that do to some of the smaller companies of the dispensaries or etc. to the farmers who are doing that? Are they going to take away their business? So again, we don't know. I know a lot of us do have a little bit of hesitancy when anything comes to Big Pharma. So I'm going to kind of leave that out there because again, if Big Pharma can figure out a way to cure cancer using this stuff, go Big Pharma. Okay, so what's my overall take? First of all, I wonder, does it really need to be a scheduled drug in the first place? First of all, it's a plant. Okay. Again, realistically, state governments, like what we have here in Florida, can handle this just fine. The way they're regulating it, the way that they're insisting the testing for impurities and accuracy, etc. It's a well-regulated program. It would be nice if the federal government wasn't involved in this at all. We just were able to leave this at the state level. Okay. But that's not what's going to happen by doing this rescheduling. Okay, but here's an important question, and I'm going to make a video just on this topic alone because I think it's kind of important. Why is alcohol and tobacco not a Schedule 1 drug? Why is it over the counter, right? We'll talk more about this, but let's revisit what the definition of a Schedule 1 drug is. No current medical use with high potential for abuse and or addiction. If that's not if that's not alcohol, if that's not tobacco, I don't know what is. So again, stay tuned. I'm going to do a video on that shortly, just really exploring that. But I think it's a very fair question. Anyways, thank you guys for paying attention to this. Please share this with other people and join us on our social media. And to further get involved, please become a Patreon member where we do put special things out, exclusive, and have access to all of my my holistic protocols and a lot of other things too. Have a great day.